Here's what we're going to say. We're going to say CVD is cardiovascular disease. MH is mental health. I'd like to tell you how I get into this stuff. So, Dr. Jagiello, my partner, if you guys don't know Ben, he's boarded in 10 specialties. I won't tell you his age, but he's boarded in surgery, pathology, drug and alcohol. He's boarded in geriatrics. He's boarded in pulmonary medicine, critical care, hospitalist. Bottom line is the guy's very knowledgeable. And so when I was, he graduated in '09, so somewhere in the 2000s, I had 3 boys that went to Kiski Prep, and it was 35 grand per kid. So Ben does moonlight, and he was at Passman Hospital. So I said to him, get me on to Passman Hospital. So long story, from that point, what occurred is with his drug and alcohol rehab, he got into helping through support groups and what they call integrated medicine. That's where you don't pay attention to what anybody's talking about in medicine because they miss the boat. There's too many people on the street that shouldn't be on the street because they're not getting any mental health treatment because we're not paying for mental health treatment. No one's talking about the disaster, let me say it again, disaster of suicide in America. My son, who's 36 years old, has 32 people that have committed suicide, and he was there for 3 of them. No one's talking about mental health. And guess what? Cardiovascular disease is the most expensive thing in the world, specifically in America, and it's the #1 cause of death. Is there a correlation? Yes, and we'll talk about that. So everybody understands how I got involved. And with that, we do a support group on Saturdays. I go twice a month. Ben does all the other ones. And what we found, the drug and alcohol population usually had some kind of a mental health complication in their life, and they felt that this substance helped. What it did was help them forget. And that forgetfulness is what has sustained them, and we have 75, 85-year-old people there. Of course, we take 17, we got too many of those as well. But the bottom line is mental health is a big problem in America, the biggest problem in America. And no one's talking about it, you can't get help for it, you can't find the doctors, there's no way to get in. And so that's why we're finding these support groups are really helping. So what we found, which was amazing, was the connection between mental health and cardiovascular disease. Hey, that's pretty good. That's not bad, huh? All right. This is the brain. And this is the spinal cord. Sympathetic, parasympathetic. What happens when everybody don't know how to spell? Scribble. Okay. Cortisol. Serotonin. GABA butyric acid. We call that GABA. Dopamine. Epinephrine. Norepinephrine. Okay? Everybody's going to understand that before we leave. You have to understand this. And no one's telling anybody. It's like no one tells anybody to drink water. I just had a patient this morning that the daughter kissed me. This patient was going to have a suprapubic catheter because he wasn't able to empty his bladder. And so we get him as a patient. He doesn't drink any water. And he drinks beer every day and coffee every day. which are both diuretics. All we did was make the guy drink 100 ounces of water a day. And he's peeing on his own. That's what's called integrated medicine. How do you get there? You gotta talk and listen. What have they done in healthcare? You don't have time to talk and they don't have time to listen. Does everybody follow me? You gotta do this yourself, but it's so simple to do, and that's what we're gonna go through today, okay? These chemicals are in our brain. I'll put chemicals with a C. And they're very intricately designed so that they are constantly in motion. Does everybody understand that? Like, and remember we've done the test, everybody look at the G. And while you're looking at the G, bring your left pointer finger in front of your left eye. And from bringing that finger there where you can see the finger, that takes 350 milliseconds. And your brain secreted acetylcholine that enabled you to do that in that 350 milliseconds. So what does that mean? Who's doing computers? And you're looking at all that stuff. Does everybody follow me? There's things that are happening constantly, and people know why they're happening, how they're happening, and what's going on to make it happen. And we're all not paying attention. And then what happens? They tell you that if you don't do this, this, this in your job, which means you gotta take it home, then you're not gonna get your raise, or you're gonna get fired, or you're gonna get demoted. So what happens? What did we talk about last time? S. Sugar, salt, and stress. Stress. What does it do? Increases cortisol. What's cortisol? We'll come back to this picture. It's pretty good. We'll put a windpipe there. Heart is here. Liver's over here. And we got kidneys. Probably should be a little bit higher. Blood vessel comes down here. Question, what do the kidneys do? Answer, everything. Everything. And we're not drinking enough water, we're taking too many pills, we're taking too many supplements over the counter, and we're drinking all the wrong things, and everybody now has kidney disease. And chances are, I don't want to tell you the statistics to scare you, but they're like over 50% of people over 50 years old have renal insufficiency. What does that mean? It's not working 100%. Well, guess what? Your parents, my grandfather lived to 94, he drank and smoked every day of his life, but he drank a ton of water and he ate good food. They lived on a farm. His renal function was perfect when he died. Does everybody understand what I'm saying? Like what we're stuck with now is processes are going on that are out of our control, and we think about it, and when we think about it, what happens? Stress. Don't forget the SSS. Stress. What's it affect? Remember those chemicals we talked about in the brain? Every one of them. Stress. What does it affect? Sitting on top of each kidney, size of your thumb, tip of your thumb, are the adrenal glands. And what do? They regulate the kidney. What does the kidney do? Everything. It's that simple. We've disrupted that pathway. And we've disrupted it in such a way that the effects of all these things are causing more problems with the heart. That might be my bookie. No, not my bookie. I can shut it off. It's amazing. What we found, guys, is it's not fair in so many respects, but nothing is. And why I want to go through all this as we go through the information and the data is you have to recognize how fast things move. 350 milliseconds. As we're talking, as we're thinking, as we're napping, whatever we're doing, there's a constant flow of energy in your body. And we're all supposed to be at this speed. And we're not. Why? Because of what we worry about, the stress, all those different things that occur, and every single time you're producing cortisol. What does cortisol do? Good and bad. What's the good? You guys have all heard the story. Mother's driving down, I think it was in California. She wrecks her car, and the car's on top of her 7-year-old daughter. And she goes out and lifts the car. Is that really possible? Yeah, because of cortisol. That's what makes that happen. Well, that's great to lift the car, but you don't want all that cortisol circulating in the body. And what happens? When cortisol levels are high, blood pressure goes up. The inner lining of the blood vessel isn't as protected. What happens? Plaque builds up. Does everybody follow the concept? So we don't want stress. We don't want this high cortisol. But mental health, that's what this is all about, guys. We got to talk about what happens in our minds and how do we control it. And it's okay if you can't control it. I'll put think, and that's how we're going to remember the mind. Body, we'll say shape. Spirit, our heritage. What does that mean? I remember growing up, we used to all have to take turns saying prayers before we ate, and my grandfather didn't like to do it. He didn't go to church. He was a different kind of character. So when they would force him, he would say, all right, good bread, good meat, good God, let's eat. And that was enough from his end. He did what they wanted him to do. But the reason I bring all this up is whether we like it or not, these things are working 24/7. They don't ever shut off. And it's all who you are, how you are, why you became who you become, all the things you're dealing with. And we all have it, guys. It's like my electric meter at home. I'm the only one home. My wife's in Florida. My kids all live out of state. It's not even going that fast. It's probably going like this. When I pull in the driveway, even before I see the cars, I look at that meter. And if it's going like this, I know my kids are home. Because all the things in the house are turned on, and they plug it in and leave the room, and it's still there. That's how you want to think about the electric in your house and home and the mind. How do you get that electric to function? You got to plug something in. Does everybody understand the concept? Okay? So what I want to make sure we understand is, remember how I put the heart down here? And we talked about think, shape. I can still leave this on the same page. Heart, kidney. And we already talked about that. Kidney is the cortisol. Oh, I didn't tell you the statistic. When the heart beats and it has to send blood to the whole body, what gets the most? Kidneys. 25% of each heartbeat goes to the kidneys. And we have 1 million nephrons in each kidney. So there's 2 million nephrons that are functioning. So right now, the fact that 50% of us have already had renal insufficiency and still have, that's not a good thing. And that's what we have to get back to. We have to get back to, everybody's got to drink water, everybody's got to understand the concept, and we'll go through the physiology so you all understand. All right, so we're going to go mental health, and we're going to put psychosis, neurosis, anxiety, depression, we'll put it here, bipolar. We'll put situational. And that is, say, a loss of a loved one, you can have situational depression. How about you get into a situation that you didn't anticipate, and at the end of the day, what we call that is post-traumatic stress disorder. Comes in a lot of different flavors. But what it does do to anybody that's involved, remember how we talked about how the body works? Now you're taking energy. So now, if you have any of these, what happens through your day is different than, let's say, somebody else. And so that constant energy that's flowing, and now something disrupts that. And the disruption, don't forget what we talked about. That's pretty good twice. Ralph would have been happy with you. All right, so remember the chemicals we talked about. All work in the brain. So, brain function abnormalities. I can give you one that was amazing to me, and personal. I was a bad kid. I don't know why. They just, there must have been someone in the family, and I got the genes. That's all I can say. So the first real bad thing that happened was Sister Judy used to make me sit in the front row because I never stopped talking, okay? And they would be in the back waiting until the Mass was about to start, and then they would come down, usually in a hurry. So I got in trouble with Sister Judy. She used to make us learn the alphabet forward and backward. I won money that way. I got free drinks at the bar. Z, Y, X, W, V, U, T, S, R, Q, P, O, M, N, L, K, J, F, D, A, B, C, A. That's what she taught you, okay? And you had to do it. And if you didn't do it, she hit you with the ruler. So I was upset. We go to church. So I took a dime out, and I took all the screws out of the front part of the pew. So she came rushing down, and of course I told all the kids, don't tell them. She comes rushing down, and as she knelt, boom, and Father Fay was coming out. So he stopped Mass, and I got beat. And that started, I was just a bad kid. Hindsight, all my friends had older brothers, I didn't, so they knew more of the lay of the land than I did, and I'd be the guy caught. One time, long story short, 3 or 4 times a quarter probably. And what he used to do is he would pull our pants down and paddle us with a wooden board. Okay? Everybody, girls and guys, and would all compare welts. You didn't tell your parents because then they would do it too. Back then it was legal. So long story short, 20 years ago now, it came out that he was a pedophile. And all of a sudden, it had an impact on me. And like I didn't plan to think about it. I didn't plan to have any emotional response to it. But once you realize how many times you got beat with your pants down, and you hear about some of the guys it has an effect. My whole point is, you can't control this. These are things that happen. And when they happen, you have to recognize it happened. And then you have to find ways in order to get yourself back to the normal function again. And how does that happen? I've done it, so I can tell you about it. It's called psychotherapy, psychoanalysis. I was at Shepherd Pratt in Baltimore on my way to go to Erie, visit a friend, and Dr. Gould told me he'd meet me at 1 o'clock at the buses. And I said, I'm not psychiatry. I'm medicine. I'm going to Erie. He said, we're having a workshop and we need volunteers. I said, I didn't volunteer. He said, you just did. So I went for the weekend and I was psychoanalyzed 3 times. Amazing, guys. I remembered being in diapers and having an accident and kind of taking care of the accident. And when my mother came behind the furnace where I was, I said the dog did it. Okay? So it takes you back that far. And I would have been 25 at the time that happened. My point is, there's expertise out there to help, and you have to recognize that if you don't get the help, the process leads to inflammation. What have we all talked about? Inflammation. That's what beats us up. And it's the same as what we talked about with the cortisol being good and bad. It's good because if you're stressed, that adrenaline rush can help you do anything. Lift a car if you're a mother. But it's bad if it's circulating in your system because it can lead to the plaque developing that becomes inflammatory. Okay, so everybody understands that? It's the concept of Too much of anything isn't good, and if you're taking from one place, what's it doing to the other place? Try to think of it, it has to be balanced. And so we have to try to find the balance. So what we identified is psychosis is where you're out of touch with reality, and what they find is some of the chemicals in the brain are quote unquote imbalanced. But as they go back, it's in the family. As they go back, they find out there could have been something, PTSD, okay? But these are the kinds of things that we don't have anymore. When I was in residency, we had huge psych units. I trained at St. Francis. They had like a 150-bed facility. You know, we don't have them anymore. So it's all outpatient, and what happens? You get put on medication. So what's the medication do? Remember what we talked about, those chemicals? Serotonin, GABA-butyric acid, all those different things that are in the brain constantly, every moment of every day working, change. Why do they change? What happened? Well, if there's no time like there isn't now, what occurs? In 10 minutes, you're getting a drug to use. What does the drug do? Has an effect on those chemicals, and what else does it have? Side effects. So you balance. Is the side effect worth the benefit? Okay, everybody understands the concept. On down through. Neurosis, we always talk about ICU neurosis. When I saw it for the first time, it was remarkable. Usually ICU doesn't have windows. So the patients go in there, a day goes by, but they haven't seen any outside, they haven't seen it get light or dark. And that's why we used to call it ICU neurosis, because they were out of touch with the reality, but there was something that initiated or actually made it occur with whatever they were having taken care of. All right, everybody understand the concept? Anxiety, most people have anxiety before a test, but there can be other forms of anxiety, we all know. Depression, I used to like to call it just melancholy. We all get down in the dumps, but if you're down in the dumps to the point where it's affecting what we call ADLs, and we'll talk about that more, activities of daily living, then it's significant enough to at least talk to somebody. The bipolar, it's a mixture of the two. What happens is, one moment you're on a high and you'll go out and spend money and do all the different things you can, and then all of a sudden you realize you don't have money to pay for those bills, and then you go into the depression. So it's an ups and down waiting. The situational part, like I told you guys, I was young. How old would I have been when I left? I went to junior high at Ross. So 6th grade, 12. So I was 12 years old. And then all of a sudden, I'm in my 20s, so half my life later, is it PTSD, post-traumatic stress? Like, what does that mean? What I'm telling you about it is you can't control it. That's what people don't understand. Like, they'll say to somebody, well, come on, just get up. Just go do this, this, and this. Everything will be fine. They don't understand what that person's burden happens to be. So we have to recognize multifaceted. Anywhere from somebody picking on you when you were little, bullying you through your life, somebody that you work with, somebody that you live with, somebody that you're around, a neighbor. We had a neighbor, anytime a ball went in her yard, she took it. And she put it in the house and she wouldn't give it back to you. So my father put a fence, and then she got upset that he put the fence. So then all of a sudden we made nice, and she didn't care if the ball went down anymore. You know, and we used to all say, you know, we'd all just point to our heads. Well, what we found out later, it was her third husband. He had heart disease, and the first two had passed away. One, right after they got married, he was hit by a car. He was a motor vehicle accident, and passed away. We never knew that. Would we have been nicer at 6, 7, 8 years old when I lived there? Who knows? But the point is, when you have this, how you react is different. So once again, all those chemicals that are working, everything that's keeping us active, doing what we want to do, this changes that. And how so? It depends on the situation, it depends on your support, it depends on who you talk with. And that's why we want to make sure, understanding these things, and we'll come back to them as we talk about treatments, understanding these things are important, but the thing that I want to emphasize today, what pocket did I put the pen in? There it is. The effects. Cortisol. increased stress, increased blood pressure, tachycardia, that means the heart's going. And what can this lead to? Stomach ulcers, bowel habit changes, and then lifestyle. If you get hit with any of those things we showed, sometimes you become reclusive. I have two sons that are doc, and so they wanted me to play basketball when they were all home, and I'm getting old. So I say, no, I'm watching. So they took a break at halftime, right? And as they're drinking stuff and wiping off the sweat, they're like, my two doc sons, Dad, are you depressed? I said, what are you talking about? I don't know, I think this is part of you becoming reclusive. And I go, what, because I won't participate? So they go, yeah, you can cover Maria. That's my youngest daughter. You'll just stand there. Well, she runs around like crazy. So I did it like an idiot, and I probably couldn't walk for about 5 days. But the point comes back to, you know your body, you know yourself, you know your motivation, you know your mind, you know your spirit. You know what moves you, you know what slows you down, you know what speeds you up. If you see a change in that, talk to somebody. And when I say talk to somebody, Dad used to always tell me, if you have one friend, you're very, very lucky. And how do you know it's a friend? He'll always be there, even when you haven't seen him. And ironically, at his funeral, I was speaking at the end of the funeral, and we had cousins that hadn't talked to each other in a while. So as I was saying what I was saying, I said, Dad always told me, if you have one friend, you're lucky. I said, I haven't seen Mark yet, but I bet Mark Catanzaro's here somewhere. And everybody pointed to it. And that's special. If you have that special friend, they can be so helpful. I used to say, just call your doctor, but nowadays, if they're owned, they have 13 minutes with you. So things have changed, but you're here in a nice place, and I'm sure there's definite things for yourself, but pass that along to friends and family, because this is real. And the things that happen, what we see, there's a lot of data out now. A lot of it's coming out of Hopkins in Baltimore. And what we see, support groups, integration with team approach. And we became part of that. It's in a place called Hunker, PA, which is near Greensburg. I get out there, I usually get there Saturdays, but I even do a day a week through the month. And what happens is, we find a lot of the people that are, use. We don't call it addiction anymore, to these groups. You talk about, let's say, alcohol use disorder, or opiate use disorder, or marijuana use disorder. But what happens is, when you're in a room and people are discussing, we'll pick a topic and then someone will talk, it opens up your mind's eye to, I've had that happen too. And before you know it, takes a little time, but everybody gets to interact and everything stays in the room. And it works out so well that I believe it's like cathartic. You like let it out and you feel better. And I've done it with even Northgate High School. We used to have a suggestion box, and I'll never forget the one girl, they heard that her mother was on oxycodone. So they said her mother was what did they call her? There was a term for it, say drug abuse, but they had a word for it that was kind of nasty. And what she put in the suggestion box was, would I talk about pain medications and their use, and how the use is definitely beneficial more than the abuse. And I did, and she was very appreciative, and it got a lot of dialogue, because people didn't want to talk about cancer back in those days. Pre-COVID is when I did all this. Since then, we haven't been back. But my whole point to it is, Everybody has thoughts through the spirit, the body, and just what the mind tells you to do and what it tells you not to do. So keep all of that as we move forward, recognizing that what we found, man, I keep putting that pen away. Go to the left. Cardiovascular disease, increased blood pressure, increased endothelial, hyperplasia, that's a blood vessel. The lining of the blood vessel has a muscle. When it constricts, your pressure goes up. When it dilates, your pressure comes down. Integrated medicine helps you figure out a way with your mind to have that happen without the medication. Okay? And I'm not suggesting everybody get off their medication, go see an integration medicine doctor. I'm just telling you this is the relationship cardiovascular-wise. So we find that the increased blood pressure, this hyperplasia, both of which come from cortisol, which comes from stimulating the adrenal gland, leads to plaque. So that affects the arteries, the veins, the valves, and the muscles. I'm not showing you my leg, I'm showing you I wear support socks every day, and I have for 30 years. Because I had uncles that were physicians, cousins that were physicians, and they tell you if you stand on your feet all the time, and then after standing for a period of time, you sit down for a period of time, that the veins can't empty. And so that's what I've done, and it works. But what happens is, if you're doing what you're doing and all of a sudden you get hit with the anxiety, the depression, whatever happens to be from the PTSD, you realize, or you have to realize, cortisol is involved. And what the cortisol does with this happening increases inflammation. Everybody heard of interleukins? There's good ones and bad ones. You're going to see that all the time. Some break up inflammation, some cause inflammation. Okay? So everybody understands the body reuses everything. So it secretes something, then it picks it up. Think of depression with serotonin. That's the make you feel good chemical in your brain. That and dopamine. So what happens? The body secretes it to hit the receptors, then what's it do? It takes it back. Well, how does the antidepressant Zoloft works? It blocks that. It's a reuptake, serotonin reuptake inhibitor, so it stops that. Same with what's the most prescribed drug in the world? 8 PPI, proton pump inhibitors. And that's the same thing. It pumps the acid out of the stomach. Does everybody understand? It's a concept of the body doesn't waste anything. It's in constant motion. It happens very fast. Don't forget the 350 milliseconds. That's how the body's wired, and that's how it's working. So when something interrupts it, you know it's been interrupted. Talk to somebody. You have to talk about it, because talking, the first thing that does, cortisol goes down. And then do you have to talk to them forever? No. There's plenty of people out there that can help. Anybody ever heard of CBT? I think I spelled it right. Cognitive behavior therapy. That's why I wrote it up and down. We're all used to reading the way we were all taught. Just like Sister Judy making me learn the alphabet forward and backward, okay? That's all in our minds. If we watch TV, you can remember the commercials, right? It gets in your mind. And like I said, I remembered when my mother thought that when that happened, I might have been between 8 months old, or 10 months old, and 14 months old. Because I was able to walk down the steps and walk over behind the fireplace, or the furnace. So again, what your mind is doing, it's in there. It's in there. What do we do? What does the body do to help your mind? That was fast. That's why it doesn't look as good. Okay? We call it the calming effect. You get now parasympathetic stimulation. The eponym for sympathetic is fight and flight. The eponym for parasympathetic is rest and digest. So your body knows this is going on, so now another system comes into play. Well, what happens when that other system comes into play? So now you have two systems working in a body that's supposed to be doing all this all the time. So what does it lead to? I'm just trying to illustrate what it leads to is a disruption of normal chemistry. How do you repair that disruption of normal chemistry? The calming effect. I did it. It was called NuCalm, N-U-C-A-L-M. And for those of you that know how to work an iPhone, this is my speed. So I can't do it, but apparently there's apps. And the apps can get you NuCalm on the phone. I did it. You lay down, you put these black things on your eyes, so even if you open your eyes, everything is black. And the sound you hear, it's not music, but it's such a pleasurable, I mean, it pleases your brain. And what you find is, they take your pulse ox, they monitor your blood pressure, everything calms down in a matter of minutes. So now we know all the things we want to avoid, and now there's something out there that we know can work. Connect the two. How do you do it? Talk to somebody first to make sure, because getting it out helps the most. But then think about there's technology out there that helps. Who invented it? I thought this was great. Who invented it? A dentist. Why? Because his patients were too stressed to get surgeries and stuff done. So this guy invented it. Now all professional teams use it. NFL, baseball, football, everything. They all use it. So it works. And once again, what is it? Sound. What is it doing? Soothing the brain. What's the other thing that helps? Music. And they recommend an orchestra because it's multiple, instruments coming together, and that harmony benefits. What's coming? You guys have heard of the med beds? You guys heard that term? All has to do with frequency and vibration. And they're out and they're working. And what it does is it stimulates the cytoplasm of the cells in the body. And that's the ones that help you defend against anything that happens to be trying to invade your body. But everybody understands when you get to the point, you have to find a way to get that calming. That's what cognitive behavior therapy is all about. And like I said, it's out there. I'm sure you guys have somebody here. But what you do is you have to tell them everything. That's one thing that I found when I did that afternoon with Dr. Gold. Some of the psych residents, they tell you word association. When they say a word, you're supposed to immediately respond, like immediately. So, they said green, and I thought of red, but I was thinking of a stop sign, and they're going, Dr. Gold, Coppola's not doing it right. So, you have to really just whatever comes, you have to say it, because that's how they get in there. But the bottom line comes back to what you have to be able to do. Cognitive is your mind. Behavior, that's what your mind does, given who you are, how you are, what you've done, why you've done it, where you're going, where you've been. That's how it was described to me first, because they're all in there. Everything's in there. Your mind doesn't forget anything. And it's remarkable that Even things that you don't recall or have your mind try to recall, it'll work, it'll remember. Like it will remember there's a phone on the back wall, okay? Like, it'll remember that. And what I used to always love, way back in the days when I started this, we used to have cookies and coffee. But the point still is, the mind doesn't forget anything. You need somebody to get into the mind with you. Cognitive behavior therapy. And why? Because they don't know what you're thinking, how you're thinking, why you're thinking. They don't know what causes your stress. They don't know what calming mechanisms you have. And if after they talk to you, they come up with something that could help you, why not do it? They're not going to give you medicine. You're not getting pills. This is, they listen, might have talked a couple times, but they find a way for you to stay calm. And I've seen many things. What's it called? Guided imagery. The first time Dr. Betsy O'Neill, who's integrated medicine that I've worked with for years, I was in the back of the lecture room, and she said, turn the lights on. So she says, put your arms at the side, get as relaxed as you can, think of something nice, and she has you shut your eyes, and we're all silent. I think it was 30 seconds, seemed like 5 minutes, right? And she goes, okay, now imagine you're on a beach, and you have a house that has a wooden deck that leads into the room and the space that you're in, and on the front there's 2 chairs. And you hear the water rushing against there. She like guides you through, and it works. It calms you down. That's the most important thing to counteract the cortisol, is a way for you to be able to calm yourself. And so making sure that you understand the concept, and then recognizing cognitive is your brain. And the behavior, again, like I say, is what events have occurred that have your brain. Here's the example. I always used to say, my parents and my grandparents never taught us Italian, okay? And I always used to say, man, I'd have got a lot less punishment, because my brother and I were never on the same page, you know? Like, we'd get caught doing something, one takes you in one room, one takes you in the other room, you tell 2 different stories, so then we both get in trouble. And so the point is that when something disrupts your routine, I'll give you one. Must be in the name. My son Matt, Easter Sunday when he was 17, says goodnight to my wife and I, you know, do our thing, goes to bed. This is maybe 10:30. At 12:15, I get a call. It's my son Matt. He goes, Dad, I'm down at the McDonald's on Route 8 in Gibsonia. I said, I thought you were in bed. He says to me, we'll talk about that later. I said, well, what's up? He said, well, there's a lot of policemen here, and I have a junior license, so come down and pick me up. I said, okay. So I get up, just jump in some boots, throw something on, and as I'm driving, I get a phone call that I don't know, and as a doctor, you answer it. And here it was Officer so-and-so at the jail. And so I show up, and as and I remember this is Easter Sunday already now. I'm standing there, and he has 2 Corona bottles in his fingers, walking towards me. And he goes, Dr. Coppola. I said, yeah. He says, your son says these are your Corona beers. And I said, did he? And he says, what do you know? I said, I drink Corona beer. That's all I said. He threw them away, and I got to take him home. But he was only 17, so I got to beat him up with one hand on the way home. They didn't have that rule, you couldn't beat your kids up until that time. But the point I'm talking about is, how do you react to that? You don't know ahead of time. I'm sleeping. I'm thinking everybody's in bed. All of a sudden, you're hit with something that's going to cause a change in that whole mechanism. That's mental health. That's behavior. And the cognitive component, they're talking about, when I say they, the research that's out there, these things are impacting your brain's capability. Elevated cortisol slows the brain memory. Is everybody with me? Pay attention, because it's important. And make sure, we always talk about the water, you have to get the water. All right, so let's go. I've had the psychoanalysis. I've been in the room with the cognitive behavior therapists, and most of them, I'd say a lot of them, have a 4-year degree, and a lot of them were in, what's the term? Like case management is what they call it now. Like they help out in the hospital to do different things, but all they had to do, I have a daughter-in-law that does it. She does a lot of therapy sessions because she got this certificate on top of her degree to be case management, okay? So these are people that have information of stress in situations. Why? No one plans to go to the hospital, ever. And all of a sudden you're in the hospital. What happens? You're looking at the ceiling and faces come in front of you. And someone's telling you to sign something. And then someone's telling you, well, now you gotta go. And you can't go home. Why can't I go home? Well, you can't do X, Y, and Z, so you gotta go to a nursing home. And so all that stress hits at one time. And that's how my daughter-in-law got into it, that she saw if you can try to find a way to minimize that stress, that's a good situation for whatever they came in for. So we have the cardiovascular disease and the mental health, and we use the kidneys. Adrenal gland, cortisol. What's it do? Everything. And remember, every time the heart beats, 25% of that blood goes to the kidney. Remember that. That's all you gotta know about the kidney. And the cortisol is the one that's bad. So, the high blood pressure, the endothelial changes that lead to plaque formation, the tachycardia, which goes into what's called an arrhythmia. What's the most common arrhythmia out there? AFib. So let's just use a case study. I have a patient, I think I talked about him before. He works at the jail, 340 pounds when I met him. Not cans, liter bottles, 3 of those a day. 3 sausage McMuffin with eggs in the morning, 2 quarter pounder with cheese in the afternoon with fries, and at dinner time he usually went to one of the fast foods on the way home, okay? And the guy ended up with AFib. He didn't want to take a blood thinner because he says that it gets physical where he's at, and he's afraid he'd bleed. So I had to send him to a mean cardiologist friend of mine that got him to take the blood thinner. The reason I'm bringing all this up is all these things this guy had. What was the stress? Parents got divorced when he was 4, and he had to live with his grandparents. And his grandmother died when he was 7. So he was raised by his grandfather. And his grandfather was a tough guy, like all the grandfathers were back then. You know, and you would not hit him. And just, he had all, I didn't know all this when I first met him, but through the process, that's what helped him the most, was going to see somebody and talking. He doesn't see anybody at all now. He's down to about 250 pounds. He's made enough money with overtime that he's retiring at the age of 62, and he just turned 60, and he's calm as a cucumber. He said, Doc, I can even sit through my daughter's dances, because his daughter does really good in dance. And I guess with dancing, you show up, say there's 100 people to dance. If your daughter's first, you gotta stay to the very end. Yeah, so it's one of those things that used to stress him out and drive him crazy. What's that do? Cortisol goes up. All the bad things I told him, he had to find a way to learn to stay calm. He put the earbuds in and listened to New Calm. And it's remarkable. So once again, guys, the process that we're talking about develops from the brain. Remember I said if you learn that front page, you're going to be golden. Cortisol, most important. But serotonin, the epinephrine, the dopamine, the GABA-butyric acid all work together as chemistry of chemicals in our brain that keep everything organized so that we can do the things we want to do and need to do through the course of our day. Once that gets disrupted, and we talked about the psychosis, the anxiety, the depression, the bipolar, situational, such as PTSD, once that all has its effect on you, most of us don't talk to anybody, don't want anybody to know. And then again, you do less than you used to do. Why? Because someone's gonna ask you things. You know, like they're gonna ask you certain, like if you haven't been out for a while and all of a sudden you come out, oh, where have you been? I'll give you a good one. I play soccer with Dr. Jack Yellow, who just had his hip operated on, so we haven't played for a while. So I go back to play before he went in. And there's a whole group of Mexicans that play with us. We've been joking around for years. It's all international. So the one guy, we call him Chico. You know, he's like, hey, I thought they deported you. You know, and it's just, these are fun people that you want to go just to be around them. And that's the part that there's so many things that can lessen stress, but we don't do it. Like every Sunday, you can find us there at 11:30. And I've done it since Ben and I were 30 years old. And all of a sudden, like there was stuff going on, things to do, and you find yourself going, It's kind of like when you want to jump in the pool and you touch it and it's cold water, but then once you jump in, you're very refreshed. It's something I know I want to do, I should do, I like to do it, but then you get away from it. Why do I bring that up? If you find yourself doing that, not normal. What did I find for me? Part of what did it was the wedding. The wedding cost me a fortune, and I got upset that we had to do it. So it was like that thing that was just sticking in my craw. But once now that I've gotten over it, for the most part, I feel a lot better, and I don't have anything that's stopping me from doing anything I want to do. What you need to do, when I say you, whoever happens to be the person that may be having some difficulties, once again, mental health. How does it affect your heart? We'll draw the I Love Lucy heart, the muscle. We have valves. Out of the ventricles come the aorta and the pulmonary, and they both have valves. Okay? High blood pressure is what increases the muscle size. Cortisol is what makes the pressure go up. The valves themselves and the arteries, three big ones. Plaque, MI, stent, CABG, coronary artery bypass graft. The valve, now they have what's called the TAVR. The data's out, guys. It's all going to be coming out. They're finding that these patients, once they connect with them in these groups to try to coordinate all of their care, they're finding that their outcomes are so much better than those that didn't participate. And then they find that when they attend these meetings and they listen to some of the youth talking, they recognize they felt the same way. They just thought that was normal. Like, Dad, I was just growing pains, thought that's what went on. It's not. We all know our bodies, we all know what we think, we all know how we think, we know what's in our minds, we know the behaviors that we have. If you see there's a change, talk to somebody. Please talk to somebody. And again, what you want to look for, the integration, I find the best approach is hospital administration, and see if they have any integrated teams for behavior as a cardiovascular risk factor group. That's a lot to say, but as soon as you say to them, integral teams, they'll know what you're talking about, because everybody's doing it, okay? And what you want to do, get the flyer. Just have them send you the flyer. That's your starting point. And as you read through the flyer, if something sounds familiar, give it a try. Because they even do it on computer. And even if you don't have computer, they can set you up where you just do the voice. Well, they'll do it on your phone, so you can listen to the people that are talking. And remember, guys, SSS, salt, sugar, stress. Stress increases the cortisol. How do you get calm? New calm. If you have a cell phone that you can get the app, get that app. Believe me I'm telling you guys, it's remarkable. I didn't believe it, but I couldn't tell a patient to do it without trying it. So I tried it. I don't know if I said to her, give me 45 minutes. An hour and a half later, she said when people say that, she just lets them go. You know, an hour and a half later, like I woke up and I grabbed my phone and I realized, wow, and you're out, but you're calm. It's an incredible experience. So please make sure, what I want to do last and not least is make sure everybody understands, you don't have to worry, but pass it along. I don't think you have to worry. ADLs, activities of daily living. So when you're sleeping, are you independent? What does that mean? Can you get ready for bed? When you get out of bed, can you do your morning routine and get dressed without any trouble? Then you go and eat. So your breakfast, lunch, and dinner. Can you prepare it, or do you have a way to get it? Meals on, I think you guys have everything here. I'm just showing you how this all works. All right, can you care for, I'll put down residents. What does that mean? Clean, laundry. And again, guys, in your situation, I don't think you have anything to worry about, but what I tell people is home care comes out, but they're only there for a couple weeks, so you have to be able to do these things, all right? And then what we call locomotion. It's okay if you have a scooter or a wheelchair or a walker, even just a cane. And why am I putting all this together, guys? Because this is the part that happens. We'll put here mini memo. Hope all of you stay away from the hospital, but if you go, that's going to be assessed. And a lot of times they don't tell you they're assessing it. They come chit-chat with you like they're your best friend, okay? And just don't ever lie to anybody, but just say you don't remember. Yeah, no, that'll tell them that you have bad memory. I don't know what you want to do to stop it. I tell the story. My father, he broke his hip. He's in the hospital, and it was Christmas. I come in and see him. He's not on any pain medicine. He's not on any psych medicine at all. I leave. My brother, who was power of attorney, calls me. He's on his way from Erie to Pittsburgh, and he says, hey, I signed up for that palliative care for Dad. And I said, what palliative care? He's like, oh, doctor called me and said that they ordered I said, I didn't order it. I saw him this morning. What happened, he said to the nurse, this is no way to live. That comment triggered a palliative care consult, and he got Ativan and Percocet. I was there in the morning to see him. I'm the doctor. He didn't have pain, and he wasn't anxious. And so what I saw was you have to make sure you have somebody that's with you, or you have to make sure that it's all explained to you, what medicine you're taking and why. And that's your right. In the back of your Medicare card, there's a number. Everybody has a representative. You have to know that, because what'll happen is they'll look at this and they'll say, well, you can't return home because you can't cook. Like they'll show you how to, like if you have a gas stove and you turn it on and you happen to leave it on low burner or something, that's like a blemish. And all those things, they'll pay attention to without you knowing. So if somebody comes, and I don't think you guys have anything to worry about here at all, but just to pass it along, friends and family, be cordial, let them come in and talk to you. You know, if you're drinking something, offer it to them. Don't cook anything, don't show them your bedroom, don't go into your bathroom. There's no reason for that assessment to be done of your ADLs unless you or your doctor asks for it. And their interpretation of what they see, you might be having a bad day, you know, and everybody does things differently. So please pay attention to the ADLs. Sorry I was late, guys. I hope you guys got something out of this, because from my end, I think you're going to see remarkable data coming out. You're going to start hearing about it. They're called integrated community teams. That's the terminology. And what they're doing is cognitive behavior therapy. And they're having these support groups that are wonderful, and they're also promoting that new comp. Now, do you need medication? If you need it, that's fine. Your doctors are paying attention to it, that they're watching your side effects. But please pay attention to, this is how the body's working every time, that 350 milliseconds, all these things are supposed to be running normally. And if they get disrupted, there could be effects related to that. You want to make sure you talk to somebody about that. And I think these teams are great. In fact, I'll bet they're going to have one here. I would think that, you know, this could always have been on top of everything, so I'm sure it may be coming. But we're involved with one, as I told you, because a lot of people, especially the PTSD, whether it's even smoking cigarettes, smoking, drinking, drugs, it's like takes their mind off of it, and that's how they forget. And obviously, all of those things are risk factors for the heart as well. Any questions, guys? Good. I was almost on time. Next time. Thank you.